Hey, Dr. Mike here, and today I want to talk about the children. I decided to do a new series. Um, Here we are in February, it's mid-February, and a lot of kids are sick. They're sick at school, they're getting sick on the playground, wherever they are, they're exposed to lots of different things. And so today I want to talk about fever, right? So if you're like me, most parents, if you're like we are, you're going to step in front of a bus for your children. I mean, the kids are just that important to us. And so we don't want to see them suffer, right? And that's part of what gets us to do things or to maybe interject or intervene before we probably should. And so what I want to talk about today is fever, right? So fever, everybody just has experienced fever at one time or another in their life. And fever it doesn't feel good. You're lethargic, you might get a headache, you want to sleep all day, you're achy. And so, but what happens when our kids get fever is right away, what I've found is that a lot of parents want to intercede. So what do? What do parents do typically? They'll give them something, right? And they'll lower the fever. But did you know that fever is actually there for a reason? And that reason is to help your baby's body or your child's body to develop the antibodies necessary to get rid of that bug. So let's say it's a virus. Let's say the child has a cold or a virus or the flu. And let's say that virus stimulates the baby or the child's body into fever. So it goes from 98.6 to say 99. And then it goes from 99 to 100, 100 to 101. And so a lot of times we'll interject and we'll use acetaminophen or we'll use some form of ibuprofen and that fever comes down. Well, did you know when you do that, you're actually undercutting the child's immune response to the virus? In other words, you're creating confusion in the child's immune system. And what I mean by that is that for every degree a temperature goes up, there's almost a doubling of antibodies or immune cell fighter cells that are happening within the child's body. So for every degree it goes up from 99 to 100, 100 to 101, 101 to 102, there's a doubling and a quadrupling. And it just continues to get the body into active mode of getting rid of the virus. And so as the body temperature goes up, the bug gets very uncomfortable because it's getting attacked. So when we lower that fever with some chemical, we're actually confusing the immune system. So I hope that makes sense. What winds up happening too with a confused immune system is stuff like this happens. And this is a great study that was done by Dr. John McBride from the association, it's out of the Journal of the American Academy of Pediatrics. And what he did was he did a 30-year study on the correlation between acetaminophen use, moderate acetaminophen use, and the prevalence and severity of asthma in children older. And what he did was he correlated and put together the two things that I'm talking about right now. Interjecting and intervening with the immune system over and over and over again makes the immune system confused. A confused immune system allows things like asthma to become reality for a child later. So, 30-year study, it's a blockbuster study. Nobody knows about it. Nobody knows about it. But look it up. November 7, 2011, the association between acetaminophen, asthma prevalence and severity, out of the Journal of the American Academy of Pediatrics. So let's close with the idea that the body knows exactly what the body needs to do. And if you could be tolerant with letting the child suffer in the short term, you'll be blessed in the long term, and so will that child. You will have a child that has a robust immune system because now they were allowed to fight that infection on their own up to a point, right? Everybody has their limits on how far they'll let a fever go. But if you let it go just a little bit longer than you normally do, I think you'll be pleased with the outcome. Child's immune system will get stronger, and instead of intervening, you'll actually be promoting a healthier response. When a temperature goes from 100 to 101, there's a antibacterial response. From 101 to 102, it's an antiviral response. Plus interleukin-2 is produced, which is what they make interferon out of. Interferon is what they use to treat cancer patients. So the immune system is going into high gear, working hard, so let the fever go a little bit. All right, hope that helps. Remember, stay informed and get adjusted.